Hello and welcome to the Fire Chief's video message. First one for 2022. Welcome, Pete.
Thanks, Chief. Good to be here.
So we're here at the new training room at Station 25 with the folks from the PIO crew. We did not videotape last month. It was a little unique situation. We're going to talk about COVID, and that was the impact for why there wasn't a December message. You know, right as we were assembling in the parking lot to do our taping, I got notice of a possible exposure to some Boy Scouts on an activity that a couple days before, and took the prudent task of isolating away from the group here at the PIO office and yourself. And that was probably a precursor of just all the chaos that we got into in December. So COVID has really taken an uptick and has gotten to be really prevalent in our community.
Well, of course, the close contacts and quarantines and even the illnesses have affected hundreds of our people.
Yep.
And I think you're going to talk about some of that, but you know, that was a good example. You know, a month or so ago, you know, you had to you were personally involved in it.
Yep. So indeed, it's we're taping this on the 12th of January, and every day the numbers change. As you look at these slides, we get a report daily that shows us the unavailable to work numbers for the MCFRS team. And that's a combination of the career and volunteer staff. These snapshots are on Wednesdays. December 1st was a Wednesday, so you know, on December 1st it was 26 people total. 21 career, 5 volunteers. A week later, 30 with 2 volunteers. A week later, December 15th, see that jump, it's now at 48. So we had gone from 30 to 48 in just, you know, 7 days time. And December 22nd, from 48, now we're at 62. We were talking about the post-Thanksgiving impact. We had done a lot of changes within the organization about mask requirements, changing mask levels, the novel hazard brief changed, a lot of adjustments post-Thanksgiving, and then we did see a surge, but that surge was later than we thought it was going to be from Thanksgiving. Hindsight tells us now that surge was the true beginning of Omicron and the impacts there. And the COVID numbers grew exponentially at Christmas time. So what was on December the 1st, you know, in the mid-20s, on December the 25th, that number was already 71. And as this bell chart shows you, and it starts on the 22nd of December and carries us through the end of this week, which will be January 15th, we saw an amazing rise in the numbers. And that middle date, which is January 3rd here, was 168 people. This chart shows blue, the career staff, orange, the volunteer staff. And the impact was immense. We did a lot of planning in the earlier stages of COVID and the earlier surges of COVID, and our unavailable to work numbers, unavailable to standby, got to the point of exceeding the organizational capacity. Members may have heard me say before, we could not hold our way through this process. And we were seeing force holds on days that were in the double digits. And that was telling and a sign of extraordinarily dire circumstances to come. So that message I sent on the 29th of December, and those changes we made, what we called phase 1, you know, we moved recruit class 49 to full staffing after their first 2 shifts out in the field. We canceled the paramedic training class. We identified Tower 35 and Squad 17 as units that could be impacted if force holds were required. Those were changes that were necessary and ones that I never imagined we would be needing to take in this environment and this level of service. And we were not alone. Let's talk about what happened throughout the regional fire services for a second as well.
Just for a little clarity, when you said cancel the paramedic class, that just simply means from the classroom, and those paramedics, I forget what the number was.
Right, so 17 medic students were on their 24-hour shifts assigned to the medic training program. They were put back into field staffing. By the end of the month of January, we aim to have a new model going forward for that class, or a return to the shift-based model. It wasn't canceled, bad word on my part. It was suspended for sure, effective December 29th. But all of the regional fire services were impacted, and all of the fire services throughout the nation, are seeing this. What else are you seeing?
Of course, the impact to our community was great as well, and obviously our efforts and impact was parallel to that. But as you mentioned, regionally, of course, everybody was paying attention to DC. They were out front. They had a lot of people in the hundreds.
Almost 360 at one point, exactly.
And a lot of attention was given to them. But all the NCR departments were coming up with contingency plans. Some were closing some stations or putting apparatus out of service because of staffing impact. Others, there are all kinds of creative ideas, shift changes and so forth. So.
And the fire service is not alone in this. All aspects of service industry, be it marketplace, grocery stores, banks, healthcare industries, and we're going to talk about the hospitals a little bit after COVID here. Every industry, ride-on or mass transit, has now had to make adjustments in their service levels because of operator and member sicknesses. So that's directly impacting our availability. And as my email outlined, these, quote, 169 folks on that January 3rd date were in addition to the roughly 75 career staff that are out for injury, or the MIDS list, who are off duty for some type of work or non-work related injury. So that just amplifies that number. Now, I want to highlight amazing work by everybody of the service. Each and every one of you has been in this campaign, in this slodge as we worked through the pandemic for 2 years now. Each of you has stepped up and done additional and offered working overtime, sign-ups, taking extra standbys, covering extra duty nights, and that is what has made our organization be able to continue to serve our residents and our visitors to the level we have, with very limited amount of force holds, as well as a very limited amount of apparatus adjustments. And that is directly because of the hard work each one of you within the organization has done. And for that, I'm immensely grateful.
And while you're talking that, everybody that's living it certainly knows this impact, but our call volume has not let up.
And that's absolutely the difference between Surge 2 last fall, winter, holiday times, and now what most call Surge 3, is call volume has returned to the 2019 level plus, roughly 5%.
Right.
So what was a lower sets and reps call volume during Surge 2 is no longer. And the 350 plus or minus daily calls for service is what you all are dealing with on a daily basis. We've had a couple 400 call days here recently, which is just another sign and indicator of the volume of need for the community support. The other huge thank you goes to all of the schedulers out there. So we have an immense cadre of folks at the scheduling office at Station 32 that take care of the career staffing, and there's the schedulers at the LFRDs that are taking care of filling in for the member who's on the Wednesday night crew who got sick or was unable to fill his or her duty. The work done by those schedulers and the duty operations chief and the duty chiefs of each of these departments is one I want to commend, one I want to say thank you and praise, because that extra work continued nonstop day and night as the pandemic hit, and ensure that the extra work doesn't go unrecognized. We're not out of the woods. I do not want to make anybody perceive that while today the number is down, it's in the 80s today, total workforce. And as that chart showed, we saw a big drop off. We've seen it kind of level out. We've got to get back to that 30-ish on a daily basis number to say we were able to return to the middle December level before we can take a breath, before we can sit back and assess the plans and move step forwards. So everybody, follow the novel hazard brief. Wear your mask. If you have the opportunity to get a booster, get a booster. If you have the opportunity to encourage somebody to take the shot, get a booster. Absolutely do that. Absolutely, for those that are going through the weekly testing and the weekly reporting process, I appreciate your diligence to that requirement, and you're helping to keep the community and the workforce and your partners at work safe. Wear a mask. Maintain your social distance when you can. Wear your right PPE on a call. Wash your hands. All of those basic, community health messages. And then specifically to us, contact FROMS. Contact FROMS. If you feel symptoms, if you feel like you were exposed, contact FROMS and get that team there with Chief Carpenter and others, on board to help you be able to move forward. So, what do you see with the hospitals? We talked about the hospitals being impacted with their staffing. Let's talk about what's going on with the EMS 700 now.
Well, certainly I'm keeping my finger on the pulse there, if you will, but from a media perspective and community looking at it, a lot of people are going to the hospitals are backed up. If you follow the chats, the county hospital alert tracking system from MIMS, hospitals are on, as all of you guys know, red and yellow all the time, and that's regional. It's Baltimore's having a huge impact too. So obviously we've put plans and things in motion to help with that, organize and manage that, but from a community perspective, it's a huge impact. The hospitals are busy. They're having the staffing issue, presumably having staffing issues as well, but that impacts us, and I'm sure you're going to talk about it.
Indeed. So EMS 700's back again. Third time in the process of the pandemic. We're using the disposition officer at the county-wide level, Alpha 7, Alpha 12. This screen was taken just 2 days ago on January the 10th. It highlighted that, as you said, 2 hospitals in Montgomery County are on red, 2 hospitals in Montgomery County are on yellow, and units having, wait times, drop times, that were far beyond the normal 25 minutes and what was the average prior to. And indeed, part of this community, meaning we've seen some multiple hour, wall times at the hospitals, and some of our partners in the DC and Washington region have seen, 4, 5, 6 hour EMS units wall time or drop times at the hospital, which really struggles and challenges the system to be able to answer those 911 calls with the units committed at the hospital.
And just a point of reference, though, you mentioned our surrounding jurisdictions. Like, I know a couple points in Prince George's County, all of their hospitals, or the main hospitals, were on reroute. And of course that impacts on us, and it impacts us almost every other day anyway, because of where our hospitals are located, White Oak and Holy Cross in particular. So the region does have an impact on us, and of course we know what's going on there.
So, indeed, the balancing the load, transporting the patient to potentially further away facility, a facility that can turn the unit around faster, but that also means the patient's being seen by the hospital and getting attention by the hospital team faster. So use that resource. The EMS DOs that are sitting there on EMS 700 are definitely balancing those sources. Prince George's County, I know, has started an EMS 800 as well, and working through that. So my kudos go out to the folks from EMS on that as well. Now, it's kind of nice today. We had an incident first thing this morning, West Deer Park, pretty significant fires. We've had some significant fires in the last couple of days with Garland and then the fire.
Bethany House.
Bethany House the night before or earlier the same shift.
Right.
The weather has been up and down, no doubt. We were in a really deep cold snap in basically the last 24 hours. We got snow on the way again, upcoming weekend. We've had some bad time on the roads here recently, as well as, collectively in the last 12 months. What do we got?
Yeah, so I think what you're going to share with everybody, and we know, of course, we respond to many of the limited access highway crashes, wreck collisions each and every day anywhere throughout the county, but in particular out on the 270 and Beltway specifically. We've had a few close calls, but we had a few collisions, I think half dozen or so maybe in the last couple of weeks. But so that is a huge impact, but I think there's a lot of discussion recently about those types of activities, but it's as all those that respond out there know, it's treacherous, it's dangerous. You need to keep your head on a swivel because things happen, and
indeed. So there's been 4 apparatus strikes in 12 months. Most recently, engine 716 on the outer loop of the Beltway. They were the blocker for truck 16 on a crash on the outer loop. Car in a spin or in a spin out condition strikes the back of the wagon, as you kind of see here in these 2 pictures, the back of the wagon. And this passenger side of the car, crumpled in, needed to be extricated. The people inside of the car, the apparatus did its job, blocking. Roll back to the event prior to that was September, engine 726. So one of the unique features here is some of these have been on curvy roadways, some of these have been at night or wet roadways, some of these have been in straight pieces of path during the daylight hours. It's just all across the board. So engine 726 is sitting on 270 main lanes just north of Montrose. They're blocking the shoulder, and what practically there's about lane 4, and the car smacks the back of the wagon right next to the Jersey wall. And it's just hard to fathom how the driver was unable to recognize, the unit there, the purpose thereof, and the move over activity. Before that, we were back in July. Nighttime, southbound 270, darkness, but dry roads. 732 is in a position, and they get struck, in a blocking roll. And then before that, the other one, which was just about a year ago, February, engine 707 is sitting on the Beltway. This is wet and daytime. But a car comes around the corner and rear ends the back of engine 707. And several of these have been significant crashes that the blocking units sustained significant damage, and our crews were protected by the blocking unit. But we, just like Frederick County, Urbana engine 231 or 923 just a couple days ago was blocking and got hit by a tractor trailer up on 270. So a lot is going on in that. So there is a highway safety process group that has been assembled since the fall, and they're working on it. And a couple things that we're looking at is, do we have the right equipment on the apparatus to provide the barrier and the buffer to the motorists that are coming around? Do we have the right direction and intent to our personnel to help you all understand how to position, how and what is the right way to block, what's the right way to warn, and how the right operational posture? Another key one that we see in a lot of lessons learned, do we have the right communication and coordination amongst the units on the scene and amongst the units arriving to the scene to place ourselves in the best conditions? And that is a coordination and planning question. We talk about high performance CPR, everybody has a plan, the crew has an activity, they know what's going to happen. As engine 799 is rolling up on the scene of a car crash, are they talking to each other in the cab so that they know what side's going to be the discharge side of the apparatus, who's going to do what as they get out of the apparatus? We definitely have to be able to all be based upon the same operating pages. In what ways can we make ourselves safer? And we've talked about dedicated blocking units. There's several organizations across the country that have taken reserved rigs, older rigs, put some of the attenuation barriers on the back of those. Definitely it's a possibility. In this county with the 270, the 495, the 29 configuration, the opportunity to have a blocking rig is present and possible. Traditional rainy day or rainy activity on the Beltway and all of our roads. So having staffed units for that, having dedicated units for that is a tool in our toolbox, not the complete solution to the issue. So a lot is going on, and I appreciate everybody that's working in that highway safety process group. And as we work through that for everybody, all members of MCFRS, think about it, take that extra second, take that extra moment, take care of crew safety, making the scene safe so that we can then focus on the folks that are on site that were involved in that original crash. So as we talk about highway safety, as we talk about crew safety, we talk about our approach to carcinogens and cancer reduction activities. Highway safety is another thing that each and every member of the service has a right and a role in approaching and making changes there. So keep your head on that swivel, keep yourself safe. As we get into this next snowfall, the next snowfall after that, make sure you're prepared for those long, cold nights. Make sure you have that extra clothing and material. And to each and every one of you who have taken such a extra effort and worked so hard throughout what we now want to call surge number 3, my great appreciation on behalf of the executive and all of the residents of the county. Thank you very much. And please, please keep at it. Keep following those guidelines. Keep yourself safe. Keep your family safe. COVID or Omicron will not be going away. It's just not, this is going to be the end of it, and now 2022, March is going to be the end of it. There'll probably be something else. So keep at it, keep diligence together, and my appreciation. So till next month and our opportunity to be back at 32 and talk about more activities within MCFRS. Again, my thanks to each and every one of you. When you're out there on the roadways, be them dry, dark or sunny, wet or congested, rural road or on the interstate, take the extra effort, take the extra second, manage your safety, take that extra step, prepare for that COVID call, come to work having the right PPE, the right mindset, and work with FROMS if you need assistance. Thank you all. Take care. Be safe.